And nowadays, the amount of THC in medicinal grade marijuana is tens, if not hundreds of times more powerful than it was when I was a teenager. So it is real medicine now. I mean, it is serious. And it can be scary. I am not an advocate of THC. However, there is real research done by real universities giving grants by the government and given the access to this Schedule I substance, which is no mean feat to get access to prove how bad THC was. And they came up with the exact opposite finding.
That's right.
They found out that it reduces the spread of lung cancer, is the most common form of lung cancer, metastasis, by 50%. So here they are getting research trying to prove how bad this thing is, and they come up with the exact opposite answer, and that's THC. Now, as far as the CBD, CBD has no high, has no druggy drug aspect to it. It is just pure pain relief. And it has been shown to be actually neuroprotective. It helps the brain recover from traumatic injury.
Well, it's interesting because, and I've said this many times over the year, when I went through my cancer, I was in severe pain.
Sure.
And the doctor prescribed hydrocodone.
Yeah.
My son
An opioid.
visited, yes, my son visited, and he said, "Mom, that stuff will kill you.
It could.
Let me get
Certainly
you,
could.
let me get you something that will stop the pain." And it was the CBD pill.
And that's the point
And that
of this
pain
program, is to,
stopped immediately after 3 of those pills. I had no more pain.
CBD.
And
The-
right there it is.
the point of the
Right there.
program, though, is to discuss with our seniors on the senior hour the use of medication, which is less addicting, even less costly, but doesn't have all the side effects that
Sure.
what is on the market right now. But think about
Absolutely.
this. The big pharma, who has so much money now on commercials and, you know, in offices, medical offices, delving out these products, and they're making billions of dollars a year, they don't want to let go of that.
Sure.
They're going to hold on to it as much as they can,
Sure.
and they're going to block
Absolutely.
anybody who's going to get in their way. So
Here's-
we've seen that happen
Here's the
before in many
thing.
other things.
Here's the thing, the research that has been done shows that, especially in the field of cancer treatment, that if you combine medical marijuana with any form of chemotherapy, the patient does better. And the interesting thing is that there is some research to support that when you take the chemotherapy away and only treat with medical marijuana, they do better too than people who are solely being treated by chemotherapy. So there's a lot of research out there, and of course some people are going to manipulate the statistics, and that happens on both sides of the equation always.
Absolutely.
But there's enough out there to give it some leeway. At least let's look into this. Let's see, what is this really about? Is there some real credibility? And right now there is a tremendous amount of good science out there that says that yes, this deserves some further investigation at the very least.
Well, I certainly hope that does occur. It's going to have to at some point.
But it hasn't for decades and decades
That's
and decades
very
in this
true.
country, and you know that conversation needs to start, and it seems to catch fire once in a while, and now with legalization throughout in many states in this country, we're starting to see the light. But the question has to be, are we going to pursue that? Is it going to be blocked somehow again? And you know, you mentioned that a company is genetically taking these medications and making them artificially. You're going to see that happen, where the seeds are going to be, they're going to use pesticides on those seeds, grow those plants, and then the question will have to be, how contaminated with these
There
pesticides
you go.
will they be when we actually use them, or if we smoke them? Think about
Yeah.
you inhaling pesticides, and we don't know it, because then they're
I'm
going
old
to block
enough to
their own research on it.
Remember paraquat? I mean, that was used here as a the defoliant back in the, what, 70s?
Mhm.
And people who were smoking that were like dying. So it's a sticky mess that we're getting into. But that, again, skirts the issue. There is natural pain relief out there. There is non-addictive, non-toxic pain relief available without a medical prescription.
That's correct.
And that's what I really specialize in my office, whether it be the CBD, whether it be the Inflamove with half a dozen well-researched nutraceuticals in it, let's call it. So starting off with the main ingredient is the active ingredient in turmeric. It has been shown in real science studies to stand up to these prescription anti-inflammatories. And besides that, it doesn't have any of the cardiovascular or cerebrovascular or intestinal risks that all of these designer prescription drugs do. And so there's always options out there. Something as simple as this. This is called an activator.
Oh, that's
your favorite
incredible.
thing in my office.
Oh, my goodness.
We did a free pain relief study just this past weekend. We saw a couple dozen people, and the criteria was you had to have at least 6 of 10 pains somewhere in your body right there on the spot. And as long as they did and they signed a release, and we're videoing these, I'm releasing them out on YouTube on a daily basis. People come in with 6 of 10 pains somewhere in the body. Some of them were 9, some of them were 8, some of them were 6. But within about a minute of using this on specific pressure points in the body, just click, 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 we got them down to 0, in more cases than not, getting up off the table within 1 minute and not having any pain at all in their body.
Well, it's interesting, and we have to take a break in a minute, but in your office, when you have done that to me, the relief is almost instant.
Yeah, it's pretty amazing.
Unbelievable. It really is. And when we come back from the break, let's talk a little bit more about it.
I'm going to be using it during the break.
There you go.
Yes. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS.